Dr. Jiangti Kong received her bachelor and master's degree in material science and engineering from MIT, and then completed her medical school training, anesthesia residency, and pain medicine fellowship at Stanford University. Dr. Kong received medical acupuncture training from the UCLA Helms Medical Institute and currently delivers acupuncture services to pain patients at the Stanford Pain Center. She's concurrently involved in research with the Stanford Neuroscience and Pain Lab and has ongoing support through multiple NIH grants. We're particularly appreciative of Dr. Kong's time today because she's got a grant that's due on Monday, and yet she's taken the time to come up here to speak with us today. So thank you for that. So I introduce you guys to Dr. Kong.
Thank you, Bobby. Good morning, everyone. First of all, thank you for inviting me to give my talk. It's my privilege to present to you our knowledge on acupuncture. So again, I think it's a hard act to follow Dr. Lemke's wonderful talk this morning, but I shall try my best. So the topic of my speech today is acupuncture for pain, an evidence-based approach. So as you can see from the title, the focus will be on the evidence. Okay, so roadmap, we're going to introduce you first what acupuncture is from both the traditional Chinese medicine standpoint and also from Western medicine understandings. And after that, we will do a brief and quick tour of the scientific evidence behind the use of acupuncture in treating chronic pain. As you can see from the previous talks earlier on, that chronic pain is a really significant and profoundly difficult disease to treat. And acupuncture, as one of the modalities, it has the advantage of minimal risk, and it really has a great promise in helping out in treating chronic pain, along with psychological interventions and medications and procedures. Okay, and then we're going to talk about medical society guidelines about where acupuncture stands in terms of overall treatment management. And lastly, we'll talk about reimbursement and some practical considerations. Next. All right. So acupuncture, actually in Greece, acus means needles and puncture means puncture. So it was first, so we don't know when it first got invented, but the idea is it's at least as old as 3,000 years or above. So it was first recorded in the Yellow Emperor's internal canon, which was written around 200 BC, but the Yellow Emperor was alive a few thousand years before that. And, all right, so that's a picture of the Yellow Emperor. Again, the beginning of acupuncture really is a myth. There's the hypothesis that in the olden times, people sit around the campfire and they find massaging each other's back with sharp stone shards was actually pretty comforting. Or, you know, in the olden battles, you can throw darts at each other and turns out to relieve his or her chronic pain. All right, so here's an interesting example of how ancient Chinese people learn and teach acupuncture to the medical doctors and how you examine them. So this is actually a piece of national treasure in China. It's called the acupuncture bronze man. So in Song Dynasty, I think that was about 1,000 years ago, actually 1,000 AD, which makes it 2,000 years ago. So they would blindfold the medical students about to pass their boards. And in the board exam, the examiner would just say, okay, go to large intestine 4. So with blindfold, they have a needle in their hand. They have to find that point on the bronze man, puncture it, and of course, a bronze man is filled with water. So once the water spurts out from the right spots, you have to get 10 of these points accurately in order to be board certified to practice medicine in China 2,000 years ago. Of course, things have changed. A little bit easier now. You don't have to be blindfolded. You have to go to a computer test, spend all day. In any case, so more serious matters. How do the Chinese medicine? How do we conceptualize acupuncture? What are the key elements? So basically, there's two key elements. One from a substance perspective, and one from more metaphysical perspective. The substance perspective, this one you can see here. This letter here, it says qi. In Chinese, it really means qi and energy. And you can see in the holographic forms, what's above there was sort of this 3-stroke thing. That actually means air, and the alacrity to flight, sort of airy and energy. And underneath is actually very cool. It means rice. And the Asian diet is mostly consist of rice, right? So it means energy. So you consume substance and gives you more energy. So that's qi. So that is sort of a quintessential element in Chinese medicine. But then where does the qi go? So in Chinese medicine, the qi goes along meridians, which connects between internal organs and external surfaces and musculoskeletal structures. So this is an example of the meridians. This is the long meridian that goes sort of from your thumb all the way to your lung, okay? And the idea is that the qi flows in 12 meridians outside and inside the human body, and that's just the principal meridians. And there's another 8 sets of extra meridians that really that channels the flow of qi. And in Chinese medicine, if you have normal flow of the qi, not too extreme and not too blocked, then that simplifies health. So that's the brief introduction of the substance aspect of Chinese medicine and interpretation of qi and flow. The next important element in Chinese medicine is the idea of balance, which is probably not new to most of you, since it's San Francisco. There's a lot of Chinese restaurants and everything here. So the key balance you can conceptualize in 2 aspects. One is yin and yang, which I'm sure you've heard ad nauseum already. The balance between man and woman, you can say that way, or between power and patience, between external and internal, etc., etc. The idea is that nothing is absolute. Within the yin, which is black here, it has a yang inside, and within the yang, which is white over there, there's a dark inside. The idea is everything has each other, is well balanced. So that's one idea of balance. So in Chinese medicine, you must have balance in order to maintain and achieve health. The other set of balance is it's like an extension of the 2 elements of the yin-yang balance. It becomes 5 elements where you have yin and yang in different directions. And here, it's metaphysical, and it's very hard to explain quickly, but I'll try. The idea, in ancient times, they don't really understand too much about diamond, too much about pearls, or whatever. They have very basic elements. There's fire, there's water, there's earth, there's wood. And then the idea is that all elements, in a way, in the world has to stay, in the universe, has to stay in balance. And the cool idea is that the Chinese, they reflected and correlated these basic natural elements with human organs and health systems. So here you can see fire is correlated to the heart and the sympathetic and parasympathetic system. And earth is correlated with the digestive system, which kind of makes sense. It's a nutrient, it's supportive. And metal is correlated with the respiratory system, particularly lung and skin. And water has to do with kidney, which is pretty intuitive, right? And lastly, wood, they correlated that to, again, not intuitive per se, I understand that, to liver and musculoskeletal system and your muscles. And the idea is that there must be balance amongst all these elements, and if there's imbalance, chronic pain can occur, and organ system disorder can also occur. Okay? So we have these 2 sort of parallel systems of Chinese idea of health. Number 1, the normal flow of qi in channels, and number 2, the balance between different influences, between the 5 elements, i.e. the organ system, and between the energy system of yin and yang. Okay? So that's a basic introduction to Chinese medicine. You got it. The next part of pathology, so we already alluded earlier, that pain occurs when this is more modern interpretation, and also it's very how would I say, very pain and it's very tangible that if you have flow of qi in meridians is blocked, and again, when you in the clinic trying to treat a patient, if you say the patient has pain, for example, have tennis elbow, lateral tendonitis right over here, lateral colitis, this goes along the large intestine and long meridian. So you identify the meridian, and you identify there's possibly a blockage of qi. Then you go to the correct points in the meridian, which can help obstruct the flow, unobstruct the flow in the qi and have it go. So that's pretty simple. And the other part is a little bit more complicated, and that is when you perceive an energy imbalance, and that's much more subtle. And that's where the years of Chinese medicine education came in. You take the pulse, you look at the complexion, you look at their tone, and all that. People think it's voodoo, but actually it's not quite. There's more and more evidence behind it. All that came in to really help you perceive the subtle imbalances in your patient. Oftentimes that has to do with psychiatric issues, the PTSD, the substance abuse, etc. They can all come in play with this part here, okay? Now, next, so far that was a traditional Chinese medicine explanation. What do we know as, Western, sort of very much reason-driven and ABC, right? So how do we interpret the benefits? Is there benefits in acupuncture, and where is it? In a way, what have we done in terms of understanding the mechanisms of acupuncture in treating pain? That actually has been the focus of my study in the last few years. But just a quick overview. Here is a classic diagram. I think Sean Aki may have already showed you how pain is perceived from the peripheral nociceptors all the way here, going through the spinal cord and up to the spinothalamic tract, to the thalamus, and to the rest of your brain. And descending wise, you have pain modulation from the anterior cingulate cortex, from the emotional cortex and memory and all that, goes down to the pericortical gray, to the medulla, and down again to provide descending inhibition of pain and modulation. So the idea is that acupuncture actually has been shown to exert influence all the way along the ascending and descending part of this pain perceptive diagram here. So if you can see here, there's peripheral adenosine release by acupuncture. The paper showed that in mice, and that was published in Proceedings of National Academy of Science just 2 years ago. And then there's also a lot of evidence have shown that acupuncture modifies the somatic afferents by decreasing the input. Endorphin release acupuncture has also been shown at the spinal cord and the brain level in animals and humans. And lastly, acupuncture is also shown to reduce inflammation via interactions with the pituitary hypothalamus axis. Yes, ma'am?